over how great this is with technology, how many people we can share this information with, and now with new medicine, how many people we can treat and help get on the path to healing virtually now, really from the comfort of your own home. We're going to talk about breast cancer tonight. It's a hot topic. It's the end of the Breast Cancer Awareness Month, and so it's a great time to discuss breast cancer specifically. I can't talk about anything in particular without bringing into view everything that's wrong with our healthcare. So we'll talk about cancer in general and the epidemic nature of it, along with all of the other chronic illnesses that are really plaguing us and a failing healthcare system. But certainly there's a lot of questions and a lot of energy this month about healthcare, about breast cancer and healthcare. Our Wednesday nights, just for those listening, will be general introductions to new medicine for anybody that wants to listen. We also have our Monday night talks for those patients and members already of the foundation, where we get much more in depth into detail and science and treatment systems of the New Medicine Foundation. But the introduction to new medicine, I'd like to start out with just to give a brief overview. The foundation was founded with the mission of really providing a new standard in healthcare. Our healthcare system, our sick care system in this country is failing completely. We have focused on synthetic drugs, surgeries, and very invasive and profitable systems. These systems can be useful and are useful when we are dying, literally, from acute illness and emergency problems. And we need those systems for those problems, but we have applied these now to all types of healthcare, preventative healthcare, childhood healthcare, and as a result, we've ignored the true causes of the problems that are causing all of the illnesses out there, and so they're getting much, much worse much quickly. The healthcare system is truly spiraling downward, circling the drain, heading towards a cliff, however you want to call it. It's very obvious. Yet there's no real answer. There's the traditional system arguing that really it's our genes at fault. We'll get into that tonight, and we just need more medications and more surgeries, and everybody thinks that we're all being told there's just a time and a place that our bodies will fail us, and that's when we'll look to the miracles of surgery and drugs to save us, but that's obviously not working. But additionally, on the other side of the treatment options, the more natural side, the alternative side, there's not really a set scientific standard either. There's a lot of physicians practicing some kind of alternative care and a lot of patients looking for it, actually more now that look for traditional, but there's just no real truth or scientific protocols to get people well. And that's where the foundation comes in and where the term new medicine comes in, right down the middle of the road, where we take the best of nature and the best of science and prove what's wrong, prove the simple imbalances that are wrong in all of us and getting worse. We do good testing, we do thorough blood testing, we do hormonal testing, we show what's wrong very quickly, and we simply go in and with the best natural techniques, we balance the body's biochemistry and nutrition and hormones quickly. And when we do that, just about everything gets better. All of these chronic illnesses are preventable. 98% of us have genes that are just fine, that have evolved over thousands of years. We're not meant to get all of these illnesses. We're not meant to need drugs and surgery to stay alive. And we certainly can't stand by and watch any longer as our bodies fail us, as our way of life fails both ourselves and our environment, and now as our children are getting sick at earlier and earlier ages. We just can't sit around and watch our children get ill at these young ages. Diabetes is epidemic, cancer is epidemic, heart disease, Alzheimer's, osteoporosis, you name it, are increasing, and something has to be done soon. The results that are attained with new medicine treatments are fast, efficient, affordable, and very educational, which is what allows us to stay healthy. So that's what we do with new medicine. We've been asked to and have learned how to deliver this treatment virtually. We organize the blood testing. We provide the education virtually. We hold our patients' hands through the treatment. It's very fun. It's very easy. It's typically a matter of weeks to months maximum. Our sickest patients might need 6 months of care, and the results that are attained are incredible. Weight comes off, blood pressure comes down, cholesterol is corrected, medications are removed. People really get their lives back. They get their bodies back. They get their sense of well-being back very, very quickly. So we want to get out there, prove what we can do, deliver it to all the people that need it. You cannot go through life watching all of the people feeling so ill, both physically and mentally. and provide the science that really sets the standard for why this works and why it's truly why people are so ill. So to get into tonight, breast cancer, I can't really start talking about cancer without doing a brief overview of chronic illness in general and what's going on out there. Chronic illness is absolutely, it's epidemic. It's the epidemic of our times. You know, 100 years ago or hundreds of years ago, the epidemics were infectious. The bubonic plague, cholera, malaria, things like that were the killers. And they were serious. And we have learned to progress past that with the technology of sanitation, really primarily, but also antibiotics and proper treatment when the infections are serious. But today, the epidemic is staring us in the face, but its onset has been so insidious in the past 50 to 100 years, and its face, it really doesn't have a face. This epidemic has several different faces. It's heart disease, it's cancer, it's obesity, it's diabetes, it's Alzheimer's. These are all variations of similar problems inside the body, but they look different, especially how they're being explained to us today as different diagnoses, different insurance codes, and there's different drugs for all of them. But really, it's one epidemic of chronic illness, and our bodies screaming for help because they are so toxic, hormonally and nutritionally imbalanced and deficient. And when you document those problems and correct them, it's almost too good to be true, but almost every chronic illness will start to reverse, not to mention the ones that haven't become symptomatic yet will be prevented. So we're living in a time right now in the modern world, and this is really a problem of the modern world. There's certainly still other problems in third world nations, and those problems need nutrition of any kind and may need anti-parasitic or antibiotic drugs primarily first. But in the modern world, it's chronic illness, and right now, 98% of us are doomed to die of something unnatural. That is how we die these days, is of cancer or of heart disease or Alzheimer's. You name it, we're not dying of natural causes anymore. You hardly ever hear about somebody simply passing in their sleep. We were designed to live 100 to 120 years and then quickly fade away for a few months as our bodies gave out. But that's not happening anymore. We're being told that it's our genetics at fault, and again, we'll get into that tonight. But that's really not true. Genetics do decide how our body responds to things. So our genetics may decide that we're going to get heart disease first, or we're going to get cancer first with the toxic and malnourishing environment that's being presented to us. But it's not that our genes are at fault. Our genes are, again, 98% perfectly fine. And leading tonight, again, with gene therapy, which is one of the hot topics in breast cancer, that's where we're headed next, and that's really a very, very scary thing for humanity and our health. Gene therapy will most likely lead to consequences that may not be correctable, whereas the primary consequences today, the primary causes of toxicity and imbalance and poor nutrition, those can be corrected. We can detoxify. We can correct our nutrition. We can correct these biochemical imbalances. We even see some signs of the genetic mutations that happen from all of these problems correct. So we're about to not only head towards a point of no return with our invasive medical treatment, or the cliff as the healthcare system and the economy along with it appears to be going off of, but we may be heading towards a point of no return with playing around with Mother Nature, with playing God, with messing with our own gene line. That's a scary thing. And cancer is going to be the illness that is the #1 epidemic. It just took over that role in this last year or two from heart disease, and cancer is going to be explained, and it is being explained as a genetic problem. It's going to be the catalyst for gene therapy that's going to potentially cause so many more problems and potentially a worsening of where we are going with our healthcare system. So a brief overview of this chronic illness epidemic. It is one epidemic of chronic illness. It has many different forms. It is the #1 cause of disease, bar none, and because it really envelops all forms of illness and death aside from acute injuries and emergencies. Cancer is now 1 in 2 in women, 1 in 3 in men, but quickly increasing. It's no longer a question of if we will get cancer, it's when, and actually how many times. People are now surviving a round of cancer only to have it come back later down the road. So cancer is now the #1 cause of death as it surpassed heart disease. Now, not everybody dies of heart disease, but 85% of us in the modern world are developing it. That is insane. That is absolutely unacceptable in our life on this planet, that our bodies, our hearts are failing us. It doesn't make sense. We weren't programmed. We weren't designed, whether you believe in divine design or natural evolution, we weren't designed to do this. Diabetes now, 2/3 of us have it. Only 1/3 of us know it. And another 1/3 of us is developing it. It's epidemic. A study just came out the other day that said diabetes may double or triple in the next 40 years. I completely agree with that. Obesity, of course, is another just worsening sign of the imbalance in our bodies. Autoimmune problems, multiple sclerosis, rheumatoid arthritis, even autoimmune problems in children are skyrocketing. Our immune systems are confused. They're toxic. They're mutated. Osteoarthritis and osteoporosis are through the roof. 25% of all men and 50% of all women in the modern world, especially America leading the way, over 50 years old, have osteoporosis. It's not an illness of calcium deficiency. It's a multifactorial illness. The same factors that cause all of the chronic illnesses that we're going to talk about tonight: toxicity, hormone deficiencies, nutritional deficiencies, basically biochemical imbalance. Too much of some things, too little of others, and you basically just have to bring the body back into balance. So, focusing on cancer and breast cancer, cancer is now the #1 killer of all human beings on the planet. That is scary. This is the epidemic that will make or break this species, I think. It's a huge thing to think about, but really cancer is our bodies attacking ourselves. It is cancer. A lot of people don't even know what cancer is. It just has this horrible, scary sound to it. Cancer is when a cell, it can be just one cell in our body, experiences enough, again, illness, toxicity, mutations of the DNA, along with our weak and sick immune systems and bodies, that it doesn't know how to stop replicating, duplicating itself. So this cell starts to replicate and duplicate and grow, and that forms a tumor, and those tumors can then spread. Cancer is our bodies gone haywire. Our cells don't know how to stop growing anymore, and so our body literally unknowingly attacks itself by growing masses of tissue everywhere. Cancer can happen anywhere. It can be heart cancer, breast cancer, lung cancer, brain cancer, bone cancer, cancers of the blood like leukemia. It's all cancer. And cancer is a chronic illness like anything else. It's perhaps the worst. It's the one that is the end result of everything bad that we're doing to ourselves on this planet. Now, 100 years ago, it was very rare. 100 years ago, again, we died of infection. We died of injury. We didn't have the acute and emergency care that we have now, which is very useful. But now we have those acute emergency cares. However, we're getting overtaken by chronic illnesses and now cancer. So there's toxicity issues, the cancerous chemicals. We'll talk about that. Toxins are certainly a huge part of the problem. What is causing our cells to go haywire and attack ourselves? But also, we know that cancer cells can pop up. Cells can go wrong. Cells can misreplicate, and DNA can get mutated by mistake. And our bodies have mechanisms to correct the DNA mutations. We also have mechanisms to recognize the cancerous cells and say, hey, that's not us. That's a weird cell. Let's go kill that thing. Let's take it out. Our immune systems can handle these things. So our immune deficiencies, our overall poor health, are contributing just as much to the cancer problems. People, they argue all the time, does diabetes and obesity and all of these things contribute to cancer? Well, everything contributes to everything. Again, to simplify it, it's toxicity and biochemical imbalances, hormonal deficiencies, nutritional deficiencies. So we're really barking up the wrong tree. We are off on the wrong direction. We are spending, I think, trillions of dollars on this war on cancer, on the pink ribbon campaigns, and so I'm going to come out a little bit aggressive tonight on the breast cancer month, because pink ribbon campaigns are completely misguided and are really doing very little to help us with cancer. They do make a lot of awareness. They bring people together. but the money is not being spent on prevention. Only early detection, and there's a lot of mismanagement of money too. There's a lot of corruption and profit and greed going on here. When we see Susan Coleman pink ribbons on baskets of Kentucky Fried Chicken, we know that there's a lot of mishandling of the money. So really these ribbon campaigns are doing nothing to decrease the rates of cancer. And this is obvious. All of these things are obvious because cancer is increasing. Breast cancer is increasing. All cancers are increasing despite the trillions of dollars being thrown at it. We are not winning the war on cancer, not even close. In fact, we're helping it get worse by ignoring the true problems. We're focusing on all of these profitable synthetic solutions, profitable companies, profitable chemotherapies and radiation therapies. We're looking at the profit of sick care-based medicine, the profit of traditional medicine, modern medicine, that again doesn't keep us healthy and doesn't prevent illness. In doing so, we're ignoring the true causes. We're even making it worse. The more chemotherapy we want to use, the more medications we want to use, the more radiation we want to use, the more mammograms we do. A lot of the testing and preventative screening are actually toxic themselves. So we're just adding more toxicity, more mutation potential, more, we're making the body weaker and weaker. And that's going to cause more cancer, more of all chronic illness. It's making it worse. These things are increasing exponentially. They're getting worse faster. People are getting sick at younger ages. People are getting cancer at younger ages. So we're losing the war. We've got to turn it around. We've got to shift focus, and again, that's what new medicine does with everything. It's not about early detection and treatment. There's not cost-benefit there. It's about prevention. How do we prevent the cancer? How do we stop wasting all of the money on the false positive testing, on the aggressive treatments, on the really inhumane treatments? Most cancer treatments have a pretty low effective efficacy rate, and the humaneness of these treatments is really very low. And we'll talk about whether we should get treatment or not. So we touched on ribbon campaigns. We'll get into a little bit more here. Every cancer treatment decision is going to be really a personal decision. And when people come to us with cancer, it's still time to get healthy. And that's what new medicine does first and foremost. Let's get you healthy. Let's get you strong. Let's treat you very similarly to the way we're going to treat most other chronic illness. Let's get good testing done. Let's get testing done that we've been taught to do, because we're not getting the testing just to find out what drugs you need. We're getting the testing to find out what is going on inside of your body. How toxic are you? How deficient are you? How healthy are you? And also to teach you how to avoid all of these problems. So the same denominators lie behind cancer: poor health, inflammation, toxicity, imbalances, hormonal excesses and deficiencies. That all, of course, wraps into the immune system. So it's the same approach. Let's get you healthy as we help you decide what treatments sound best to you, because when you get a diagnosis like this, when you get any diagnosis these days, it's really scary. The fear tactics of traditional medicine come in, and it's almost overwhelming. What do you do? Typically, it's almost it's very aggressive what you're asked to do with any illness. You need this surgery, you need this drug, you have to take these drugs, you have to do this surgery, or you can't be my patient anymore. That's just one other aspect of the treatment that's so wrong. Cancer is even more scary because it's radiation, it's chemotherapy, it's slash and burn, aggressive, profitable, expensive treatments that have different success rates for different cancers. The average rate is about 10 to 15% improvement in survival for certain cancers. Some are much higher, some are much lower. So it's all a decision-making process of what should I do, what sounds good to me. Do I want to do the surgery? Do I want to do the radiation? Do I want to do the chemotherapy? Do I want to do any or all of it? How much is this going to help me? What's my life experience going to be like during this treatment? Is it worth it? Now, aside from that, am I healthy? Is my body strong? Am I hormonally balanced? Am I living a toxin-free lifestyle? Am I detoxifying myself, both physically and mentally? Am I structurally and electrically balanced? Those are all things that need to be addressed with cancer. Of course, the number one problem is toxicity. Chemicals everywhere. industrial chemicals, household chemicals, chemicals around the world, oil spills. You name it, we're surrounding ourselves with carcinogenic chemicals. Most of our medications, almost all of them, I would say, that are prescription, are toxic chemicals, and most can be seen to be carcinogenic, even that it will be on the medication pamphlet. So we've got to stop over-medicating ourselves just because the powers that be don't like the fact that there's not a lot of profit in natural health care. Natural supplements that we need aren't very expensive. You can't patent them. You can't mark them up 10 or 100%. So we focus on all of these toxic remedies. It's killing ourselves, it's killing our world, it's killing the entire life experience. Most recently, the last couple decades, it's toxins in our foods. And how can we toxify ourselves even more than what's surrounding us at all times? Put it in our food supply. Something that we put into our body day in and day out, which is what we've allowed to do, again, in the name of greed and the dollar. Additives, fertilizers, hormones, antibiotics, food colorings, you name it. We have to learn to label read and see what we're eating. We have to be educated on where all of this toxicity is now coming from. That's a side effect. That's just a part of the new medicine treatment, probably the most important part. We attain health and restore balance quickly. We detoxify and give the body what it needs. It's documented in the testing. Keep it very simple and neat, but the education that comes through the process changes you forever and teaches you how to live this organic, life-sustaining, symbiotic lifestyle that promotes life, promotes nature, promotes sustainability with our entire world. We're relying more on drugs. We're relying more on the end result. All of the ribbon campaigns, all of the war on cancer campaigns are focusing on the treatment. Let's detect early so that we can aggressively treat with more drugs, more chemotherapy, more surgery, more radiation. Well, you know what? That's all increasing toxicity. So we may need that some of the time, but first and foremost, 90% of the time, we've got to get to the prevention. There really is no prevention. That's all about the things we're talking about. And the last part that I'll save for a little later, again, the gene therapy. We are playing God with our world and our foods, GMO, genetically modified organisms. God, move over, again, extremely profitable, patentable. That's where we're going to head with the healthcare treatment of cancer, and it's going to be perhaps a point of no return. So the flip side that we have to focus on, aside from the toxicity and the cancer-causing chemicals, is the fact that these same toxins are creating a poor state of health in our body, and we're not able to handle any cancer cells that pop up. We have very weak immune systems because of all of these deficiencies and imbalances. We should be able to find these mutations and correct them. We have evidence that that happens, but not if it becomes overwhelming. So there's one way to prevent cancer. There's one common idea, and that's organic living, organic balance, natural life, staying away from toxins as much as possible, staying away from chemicals, staying away from medications, getting truly healthy. Our physicians, our healthcare system does not enable this, educate people on this. It does nothing at all. In fact, again, it makes it worse. It takes your focus away from your health. It says, you have this little problem, you need this drug. You have high blood pressure, you need this drug. You have high cholesterol, depression, fatigue, anxiety, osteoporosis, menopause, whatever you have, you just need this drug, you need this surgery. There's nothing wrong with you underneath it all. Or maybe there is, it's your genetics and they'll do gene therapy on you. But then eventually it comes to the point of life or death situation with cancer, heart attack, you name it. So we're just ignoring the problems much, much too long. And it's unfortunately coming to get us. It really is a sign that we have ignored this too long. We are being greedy with our healthcare system, and it's coming back to haunt us. And the time is coming here because it's really coming to a breaking point. Cancer's through the roof. It's epidemic. All of these problems are epidemic. Our children are getting sick. We're living shorter lives. We're certainly living much less fulfilling lives. Our world is having problems. Our climate change is definitely we're having some impact on that. So it's time to find a new way. And again, there is no standard out there. New medicine needs to be the standard. It's scientific, it's natural, it works, it's quick, It's educational, it's fun, and it creates only good things out of life with new health, new life, new vitality, new relationships, new appreciation for friendships and living with the world naturally in a sustainable way. To get into breast cancer specifically and this month, breast cancer is very scary for women. It's one of the scarier illnesses out there because I think it's just so out there in the open. It is now 1 in 6 or 1 in 7 women will develop this. They're developing it very early in life, in their 20s and 30s now. And it's increasing. And there's a lot of, just as there is with all illnesses and all cancers, there's a tremendous amount of misinformation. The rates have been steadily increasing as long as we have been recording, except for 1 year. I believe that was either 2003 or 4, when they had done this very controversial Women's Health Initiative study. They found that all of the women who had been treated for decades with synthetic hormones, key word there, not natural hormones, but they studied women on synthetic hormones to see if it was helping their health or not, and they had to stop the study early in 2002 or 3 because it was extremely obvious that the women on these synthetic hormones were getting much higher rates of breast cancer and really all cancers and all illnesses, including heart disease. So they were forced to stop the study. Well, the backlash from that was that 2/3 of the women on synthetic hormones, and these are commonly known as Premarin or Prempro, Depo Provera, these are hormones that are, again, synthetic, toxic, fake, carcinogenic. We know they're bad for you. They're used because they're patentable, profitable, and that's what we're taught to use as physicians in this country. But the backlash from that study was 2/3 of the women on this treatment got off. They got scared and they got off the hormones, and that was great. About half of them got off completely, and half of them started really looking for alternatives, and that's when the boom in bioidentical hormones came about, because we all know there's hormonal issues, and it is true that we need hormones, but of course we should be using the natural hormones. New medicine promotes very careful hormonal, very conservative hormonal treatment with, of course, bioidenticals, but replacing only the ones we need and only the ones that won't come back on their own. Well, after those women got off the synthetic hormones, the Premarins and Prempros, enough of them came off that in the several years that followed that, there was actually a very, very slight dip in the rates of breast cancer. And I'm talking very slight. I think it was maybe 1% or 0.5% of the new cases that reduced. So that was sign enough, though, that we know these synthetic hormones cause cancer. But then the epidemic just kept marching right on, and it's been increasing ever since. So that had an impact, but that's why synthetic hormones are an important cause of cancer. They're an important cause of all health problems. They are a major toxin in the body to which we react with inflammation and mutation and immune system weakness, but it's certainly not the end story. The story is of cancer, and of breast cancer, of course, is all of the toxins, all of the carcinogens, all of the poor health that we really have. The diabetes plays in. The same things that play into heart disease play in. The same things that cause osteoporosis. It's all toxicity and biochemical imbalance causing all of these illnesses. It's just an onslaught of a poor health state in the body. And then, yes, it's up to our genes to decide how long our systems can hold out. So one family might have problems in their heart system first. One family might have Alzheimer's first. One family might have breast cancer first. It's everything is genetic. Everything about us is genetic. So saying that these illnesses are genetic isn't untrue. Our genes are going to help decide where we get sick first, but it's not our genes causing the illness. It's the toxic, poor health, poor nutritional environment that's being given to the body through our toxic world and our toxic lifestyles and our toxic now foods and increasing medications and stress. All of the imbalances that we have are what is making us sick. Again, we know this. Look at populations that live where humans are supposed to live. We are supposed to live with nature, getting good sunlight, eating natural foods that grow in natural places, not manipulating the food supply and putting excessive chemicals and fertilizers and pesticides and antibiotics and hormones into our foods or into us. You know, we know hormones are a problem. We know especially synthetic hormones are a problem. Well, one of the main things that almost every doctor does is give women hormones of some way, whether it's birth control pills, hormones for menopause, or even in men who are now becoming aware that men are hormonally imbalanced as well, we're giving men synthetic testosterone. That's a toxin. That is a carcinogen that causes cancer. So it's not rocket science. We should not be doing this. We're making the problems worse. We're ignoring the true causes of the problems. It's not rocket science that it's coming back to haunt us. So one of the biggest hormones to talk about and to answer some questions about breast cancer, estrogen. First of all, synthetic hormones. Should we take them? Absolutely not. No, we should not take any synthetic hormones out there at all. They are in everything that we consume to begin with, so we certainly don't need to take any more. Estrogen is one of the worst ones to take. It's one of the ones that's been given the most to women, and it's one of the toxins that is the most ubiquitous in our environment, in our foods. Synthetic estrogens, xenoestrogens, they're everywhere. The primary cause of not only breast cancer but all health problems and all cancers is the fact that we're toxic, but we're very imbalanced with too much estrogen and too little of other hormones. Estrogen and androgen imbalance. We have way too much estrogen. We have not enough progesterone and testosterone. We need to get that balance fixed, and it's by detoxifying and learning where that estrogen is coming from, getting off the synthetic hormone medications, even most of the time getting off the natural estrogens. That's what's going so incorrectly in the alternative world, is that most doctors are using natural estrogens. The reflex response is, well, hey, the synthetic estrogens were bad, so let's use natural. Well, that's half right. We need to get away from the synthetics, but the bigger question, the newer information is that estrogen itself is a problem. Even natural estrogen. There's too much everywhere. You can talk about soy as well. You can, of course, talk about the dairy industry and any of the livestock, how much estrogen is used in the raising of these animals. And then we ingest this. Estrogen makes our cells divide. It makes us put on weight. It makes us inflamed. It does really a lot of the things in high amounts that we don't want. Of course, natural estrogen has a purpose, but we have much too much in our bodies. So this is a problem with breast cancer, but it's a problem with any cancer. Uterine cancer, prostate cancer, and then even large prostates, everything. It's a huge problem. So to talk about hormones, we should not be on any synthetic hormones. We do need careful and appropriate conservative hormone replacement of certain hormones, but only certain hormones. It should be well documented, well tested, and appropriately prescribed. Of course, bioidentical, organic if possible, at the right doses. Healthy aging doses, not anti-aging. Anti-aging is the opposite problem in healthcare. It's, well, if a little natural is good, let's do a lot and we won't age. That doesn't make any sense. And actually, anti-aging levels of even natural hormones will cause us to age faster, stress out our body, and again, probably cause more cancer. It would be a little bit of a flip, 50-50 there. Being healthier on some hormones would help, but we're using way too many hormones in anti-aging. So we promote the principles of healthy aging. We make sure we replace the hormones that are needed, the ones that are extremely deficient, and there are some that are very, very deficient now at birth in children. There's some hormones that may be low, but they may come back naturally as we get someone healthy. Thyroids can respond very well as we get somebody healthy overall within a few weeks. Growth hormone can come back very quickly in patients when we reduce their insulin levels. So we replace the hormones that are needed, and they are needed. They are very important, but we don't replace the ones that aren't. And estrogen, really, we hardly ever use. Sometimes we have to use very low dose natural estrogen in women, but because they've been exposed to so much estrogen over the years, usually as a result of medications, that they're very estrogen resistant, and you have to use a little bit or they're just miserable. But the goal, and usually 95% of the time, we get women away from all estrogen. We document very high levels in their body. We detoxify them from it, and we teach them how to avoid it. So estrogen is a big problem. Progesterone, usually very, very beneficial for women, of course natural. On the stories that they'll talk about, they'll be talking about synthetics and this and that. Nancy Snedeman on the Today Show was talking about, well, she just made a blanket statement, synthetics are bad, so naturals are bad too. She's completely wrong, completely misinformed. She's not being trained in these things. She has no really financial incentive to get trained in the true natural science that's out there. They're talking about synthetic progestins, the proveras, completely different. These chemicals like the Depo-Provera shot lowers the natural level of progesterone in women, makes them feel horrible. Women are very low on progesterone. They typically really benefit from some replacement and really need it, not only for strength and cancer defense, but overall health, mental well-being, physical well-being. It does a tremendous amount. Same thing with testosterone. Remember, it's got to be done the right way. So let's get into genes a bit. Again, we're talking about genes and where we're headed. Where the treatment is going to head is gene therapy. We're talking about the BRCA genes, the HER genes. There's BRCA1, BRCA2, HER1, HER2. They're kind of going, they're off barking up the wrong tree again. They are applying very expensive science, very expensive gene therapy to, well, let's figure out which genes might be the ones that are getting mutated, and some women might have some genes that are more susceptible to mutation than others. And let's start focusing on those genes. Let's start testing women and doing radical mastectomies so they don't get cancer. Let's start focusing on how we can go and change these genes. And again, it's not our genes aren't changing. So our BRCA genes, our HER genes aren't changing. Evolution, our gene line doesn't change that quickly. Our genes haven't really changed in 50,000 years if we want to look back that far and look to the Darwinian way of thinking. Our genes are just the same as they always have been since we were Homo sapiens. What's changing is the toxicity. So we'll be able to find lots of genes that may be more common in certain people. But if we go start changing those genes, we're going to create a nightmare of unintended consequences. We're already experiencing unintended consequences with all of the chronic illness and cancer out there. It's all a side effect of the way we're living our lives and changing our world and playing God with all of our food supply and our chemicals. But if we start to change our genes, we may not be able to undo that damage. Those genetic changes may get passed on down through our gene line, and we're really playing with fire there with the future of our species. There's a great quote out there: we're a species committing suicide. We're killing ourselves. And it's very obvious. This way of life is not working. Once you have breast cancer, and to talk about, they'll want to do genetic analysis and look whether you're BRCA1, BRCA2, or HER1 or HER2 positive, and that's going to affect their treatment. That's a different discussion. Again, once you have the cancer, you have to decide what you're going to do. What are the pros, cons, the benefit ratios? What's the treatment experience like? You have to do a lot of research. But new medicine gets up to the cancer problem, approaches the cancer problem from the very beginning. You know, let's not wait until we have cancer. Let's not wait until we have any symptoms. Let's make sure we're healthy. When any patient comes to us, whether they are just starting to feel not well or not, they don't even feel unwell at all, or they've been given a terminal diagnosis, we're going to, again, get that scientific information to see what is going on biochemically. I don't want to know what your genes are. I know that 98% of my patients have genes that are just fine because we know this. What I want to do is restore a healthy environment, a healthy foundation of biochemistry and nutrition and hormonal balance to that patient as quickly and as naturally as I can. I want to detoxify them, get the cancer-causing toxins out. I want to get their body healthy and strong. I want to replace vitamin D3 levels and any hormones that need to be replaced, any nutrients. And most importantly, I want to teach them where this is coming from, how toxic of a life they're living, how toxic the foods are. That's what we have to get to. We don't want to focus on, well, you've got this gene problem, and let's use this $100,000 gene therapy problem to go start changing your genes, when the primary problem is you're not healthy. Nobody's healthy. You've got to get healthy first. And the beautiful thing is when you do that, almost everything goes away. It literally goes away. The body does not want to be unhealthy. The body wants to be healthy. It wants to heal. And it will start doing that immediately, which is why the power of the three components of new medicine done together so quickly bring about change. People so quickly feel better, lose weight, have biochemical changes like cholesterol and blood pressure correct. We are then able medically to start removing medications that only accelerate the detoxification and get people healthy again. So when approaching cancer, whether you have it already or you don't, our approach is let's get you healthy. Let's get the toxins out. Let's restore the strength to your body so your body can naturally be healthy, fight this cancer. You can feel healthy mentally because all of these biochemical things make you feel incredibly healthy mentally. And let's get you as healthy as we possibly can right now. Then let's talk about if you're already being offered or really threatened with treatment mandates will help decide what we want to do and what we don't, because again, not all treatments are the same. So again, there's only one way to attack cancer, and we're not doing it. All of the pink ribbon campaigns, all of the awareness campaigns, they are riddled with corruption. I'll say it right here, and it's very well known. The pink ribbon campaigns, the Susan Komen for the Cure campaigns, all of these campaigns are really riddled with corruption, focused on greed and profit, as almost everything is happening in our world economically is these days. We have to focus on health. No, it's not that profitable. It's not that expensive to get healthy. It saves money to stay healthy. It's going to reduce the economy of this country to be and stay healthy. You eat less, you use less products, you're much more health conscious, you live a much less consumptive life. You don't need much medical care, you don't need much doctoring, you don't need many medications. So nobody wants to do this because we're all staring a depression in the face, and the last thing the political body wants to do is do something that's going to reduce the economies. Well, when you get healthy, it reduces your economy. It saves everybody money. So that's why they don't want to do it. They want to sell more drugs, do more treatments. They want to do more invasive screening tests, and it's really unfortunate. But again, it's a system on the brink of disaster, and it's going to show itself to be very very problematic here very, very soon, as things just aren't working tonight. And if there's any more questions about cancer and breast cancer, you can send them in on the chat or the question form. Someone had asked about the vegetarian foods and Bill Clinton, whether that was really what he was following. I'll answer that really quickly. I don't think Bill Clinton's very healthy at all. He had a quadruple bypass, I believe, so I'm not sure what diet he's following. He doesn't look very healthy. I think he's lost a lot of weight, but he looks very gaunt and very, very malnourished. So that's sometimes what happens when people aren't doing the hormonal and nutritional fortification. They're just simply trying to kind of go really the other way and maybe live vegan. You can avoid some toxicity that way, but there's going to be nutritional and hormonal deficiencies that add to the inflammation of the arteries, that add to heart disease, that increase homocysteine levels. There's B vitamin deficiencies and D3 deficiencies. Again, all of these key components of the biochemistry that we restore in people is so much for what's going on in heart disease as well. And you've got to get to the root of that entire problem. Talk a bit about, there's a question about juvenile problems, ADHD, autism. These are the epidemics. This is how chronic illness epidemics show up in our young children, in children that are pre-pubertal or even not neurologically developed yet. There's really no one answer for autism or ADHD yet. Of course, we're overdiagnosing it and overprescribing it, but what it is the same toxicities, inflammatory problems, and really hormonal and nutritional deficiencies. In children, their organ systems haven't had time to break down yet, so they may not develop the cancers and the heart diseases yet. It takes decades to do that, but their neurological system is at risk, especially in the early years, and that shows up as autism. It shows up as poor behavior. It shows up as kids not being happy. You know, there's a story on last night on the news about bullying in schools. Well, we know schools are getting different and technology is getting different, but we don't feel good. And in kids, it's more mental than physical yet. Kids are getting diabetes. They are starting to have poor signs of physical health too, with obesity and high blood pressure and high cholesterol, and even signs of heart disease at very early ages. But even before that, especially as they're heading into their hormonal years, and their bodies can't produce these hormones because of the toxicities, the hormonal disruptions, the nutritional deficiencies, they feel bad first. They mentally feel bad first, and that's what's happening in our kids. In the youngest kids, in the 1, 2, 3-year-olds with all of the autism that's now, I think, greater than 1 in 100 or greater. Again, it's their neurological systems, their hormonal systems aren't developing properly from the same problems that's causing the Alzheimer's in an adult. It's autism in a child, and that's what's happening. So it's teaching families how to detoxify their lives. It's looking for biochemical imbalances and treating them when it's appropriate. We try to get kids to their pubertal years, try to see if we can get them healthy and cleaned out enough that their hormones will take off for themselves. But if they don't, and serious problems occur, functional problems where they can't function in life, can't function at home, that's when you have to step in and treat. But we're only treating with natural things. So even if we have to use a little bit of a bioidentical hormone in a child, it's time to use it if they can't function and they're looking at life-threatening problems or medical treatments that are just going to be more toxic and make them worse down the road. because they just get on that bandwagon of downward spiraling medication increases at younger and younger ages. So that's what's going on in our kids. It's really not rocket science. It makes a lot of sense when you think about it as we develop. Fibromyalgia and arthritis and inflammation kind of go hand in hand. Inflammation is a common problem with all of our health. Inflammation in the brain is Alzheimer's, and the heart is heart disease. In our immune systems is autoimmune illness. Inflammation is one of the common reactions that we have to all of this biochemical imbalance. We react to toxins. Our deficient immune systems can't control the inflammatory reactions. Our whole bodies become inflamed. So inflammation in our joints is arthritis. Inflammation all over our body and in our muscles is fibromyalgia. And we typically have cases of fibromyalgia improve so quickly, it's almost mind-boggling. It can be just days and it goes away. We've got to address all of the hormone systems. And in some arthritis patients, and any patient, the illness can be too far gone where we won't get 100% correction. But a key component of major inflammatory problems, of course, it's going to be detoxifying and restoring health and nutrition. Adrenal work, adrenal fatigue, and adrenal failure is a huge part of severe inflammatory problems when the chronic illnesses are, you might call them end stage. They're just getting worse and worse. Medications aren't doing the trick anymore, and there's just no symptom control. Where we do our thing and get people healthy, but they still have inflammation and achiness. That's when we step in and really focus on adrenals. We replace bioidentical cortisol, which is completely misinformed in society. We're told cortisol is the enemy. This is where we jump in and actually use bioidentical cortisol, which is very well absorbed in the body and can be miraculous in reducing inflammation, making people feel better, brain fog, energy problems, sugar cravings. That's a huge component. The last question I want to touch on from Donna, always great questions. How do we keep our bowels moving and help keeping the toxins moving through? Once you get healthy, it's going to be a constant lifestyle to stay cleared out. We achieve a tremendous amount of detoxification and health in just a matter of weeks. But again, we're living in this country. We're the leader of toxins, so we're going to be continually toxifying again, even if you're trying to live as toxin-free lifestyle, as an organic lifestyle as you can. And you can maintain a very organic lifestyle, but until we live back in the wilderness and back on the ocean all the time, the clean ocean, the rainforest, we're going to be exposed to paint fumes and toxins, and we're going to get exposed to foods that aren't perfect. We're going to get exposed to chemicals, and they're going to be into our body. The first place that typically causes problems is the GI tract, our colon, our bowels. We've got to keep it moving through. Part of what we teach when we treat people is we teach them to clean their colon. It's a very important part of getting healthy, but also then to recognize from then on out, to recognize bowel irregularity before it becomes a problem. So we teach people, if you have one day where something is different, where you either have loose stools, and we love to talk about poops here, most doctors don't, but if your bowel habits change, something's wrong. Something's wrong in your body, and primarily it's going to be you ate something bad. You got exposed to something bad. Happens very commonly after parties or trips or whenever people decide, yeah, you know, I'm just going to throw the healthy living out the living for one night, and that's okay. We've got to do that from time to time just to kind of feel a little bit quote unquote normal in this crazy toxic world. The next day you're going to notice you're going to be backed up. This is how you gain 5 or 10 pounds in one night. You're inflamed, you're swollen, you haven't gained 5 pounds of fat in one night. You're just retaining water, your colon's backed up. You immediately have to apply what you've learned, get that colon cleared out. That is an important part. With water, with good, healthy, natural colon clearing products, with you can do lots of vitamin C, lots of magnesium, lots of probiotics, lots of the healthy bacteria that get into your colon. And you're not getting that stuff from Activia or any of the yogurt products out there except maybe Stony Brook. We teach all that. It's an educational process to learn to listen to your body, listen to how it feels, and get on top of that problem before it becomes a problem. You should always weigh yourself at least every couple days. Really, every day is great just to see what your body's doing. Weight's another great marker, an easy marker to show you what's happening in your body. So that is right up to 8:25. I appreciate everybody's. Looks like everybody's still there. I appreciate it. We're going to have all of these recorded for everyone. I'm going to take a break, pass it back to Miss Johnson if she is still there. See if there's anything else we want to talk about tonight before we head up on 8:30. And thanks again, everybody, for listening. This is Dr. Pearson.
I certainly am here. Thank you, Dr. Pearson. That was an excellent segment, as usual. Great information. I've just unmuted all of our guests. If any of you have a question, we only have 5 minutes. Actually, we have 4 minutes. The clock is ticking down till this segment ends. If any of you who are unmuted would like to pose a question for Dr. Pearson, please feel free.
Hopefully I answered all of them. That was
I'm confident that you have, and everyone on the call knows that they can always chat the question in or use the question feature. So we will go ahead and stop recording this call. Again, if you would like a recording of this webinar, send me an email, please, marketing@dnamovement.com. I'm happy to send you the recording. It'll come through You Send It because it will be a sizable file. I'm happy to do that for you. Great information and something that you can pass along to any of your guests. And we are going to just turn it back over to Dr. Pearson for just to end the call.
Well, thanks. I just wanted to add one more thing. You know, as we head out of this month of breast cancer awareness, what should we do to all of those that are concerned, to all of the people that are out there marching for the pink ribbons? We need to just redirect the awareness. Say, you know, this is great. This is awareness, but we're not preventing it. You need to learn how to prevent it. You need to listen to these informational webinars and learn the true problems. So that's really what we need to do. That's a lot of the times there's a lot of great information, but we don't know what to do. Refocus that energy. Refocus the desire to help people with their health, to help truly prevent the cancer. Let's redirect that awareness to, you know, we really need to talk about prevention, and that's what we're not doing. We're only talking about treatment here, and that's not going to help the cancer rates come down. It's just not happening. So hopefully we can all get out there and do that before the cancer problems continue to get much worse.
Okay, Dr. Pearson, thank you so much. We're going to end the call this evening. Please join us again next Wednesday for another informative session with Dr. Edward Pearson. Again, any questions, please address them to marketing@dnamovement.com. This is Patty Johnson, VP Operations. Thank you once again for joining us. Have a great evening.
Thanks, everyone. Good night.